Have you ever wondered why something designed to help people with disabilities ends up being one of the hardest benefits to actually get? The Canadian Disability Benefit sounds like a lifeline, but for many, it feels more like an obstacle course filled with paperwork, rejections, and long delays. People living with real challenges are being forced to prove and reprove their struggles just to access financial support that should already be there for them. Today, I'm breaking down the 5 biggest reasons why it's so tough to qualify for the Canadian Disability Benefit, and trust me, these are things you need to know whether you're applying yourself, supporting a loved one, or just curious about how our system really works. If you care about fairness, accessibility, and real support for Canadians with disabilities, then stick with me till the end of this video because I'll be laying out exactly where the system falls short and what we can do about it. Before we dive in, do me a quick favor, hit that like button, subscribe to the channel, and ring the bell so you never miss future videos on disability support, financial freedom, and midlife resources. Let's get started. Strict eligibility criteria, the CDB, is designed to provide financial relief for Canadians with severe and prolonged disabilities. However, meeting the eligibility requirements is often a high hurdle. To qualify, applicants must first be approved for the Disability Tax Credit (DTC), which itself is not an easy process. Doctors must provide extensive medical documentation proving that a person's impairment is both severe and long-term, affecting daily functioning in specific life activities. Many applicants face rejections because the medical forms are filled out incorrectly, the language used is too vague, or their disability doesn't neatly fit into the federal government's rigid definitions. This creates a gatekeeping effect where individuals with real limitations fall through the cracks. Furthermore, the reliance on medical professionals means that costs and wait times add another barrier. Even those living with visible or chronic conditions can be denied if their paperwork doesn't align with the criteria. For people with fluctuating conditions, like mental illness or autoimmune diseases, the process is even more complicated since symptoms may not be constant. These strict requirements are intended to ensure fairness, but they ultimately exclude many who need the support most. Complex application process applying for the CDB is not straightforward. It requires navigating government portals, filling out detailed forms, and coordinating with healthcare providers for supporting evidence. The paperwork is lengthy and filled with technical language, which can be intimidating or confusing for people with cognitive impairments, mental health challenges, or limited literacy skills. Many applicants report feeling overwhelmed, and without guidance, mistakes are common. Missing a single form, forgetting a signature, or submitting incomplete medical records can result in delays of months, or outright denial. The bureaucratic nature of the system means applicants often face long wait times between each step of the process, from initial submission to review and decision. For those already struggling financially, this waiting period can be devastating. Additionally, because the CDB is still relatively new, there is limited clear guidance on the exact process and standards, which leaves applicants in uncertainty. Nonprofit groups and disability advocates often step in to help people through the maze, but not everyone has access to such support. The complexity of the application creates an unnecessary barrier that prevents many eligible people from accessing funds that could significantly improve their quality of life. Limited awareness and accessibility. Another major barrier is that many Canadians with disabilities don't even know the CDB exists or how to apply. Awareness campaigns have been limited, and much of the information is buried within government websites filled with jargon. Those in rural or remote areas, Indigenous communities, or people with limited internet access are especially disadvantaged. Language barriers also play a role. Official resources are often only in English and French, excluding those who speak other languages at home. Accessibility for people with disabilities is also inconsistent. Online portals may not be fully optimized for screen readers, leaving visually impaired applicants at a disadvantage. In-person support is minimal, as government offices are often understaffed and undertrained on disability-specific needs. This lack of accessible, clear, and widespread communication creates inequality in who learns about and successfully applies for the benefit. As a result, those who need it most, low-income individuals with multiple barriers, are the least likely to gain access. Without stronger outreach, many Canadians will continue to live in poverty despite being technically eligible for financial relief. Financial restrictions and delays even for those who qualify. The financial structure of the CDB makes it less accessible than it seems. Because it's income tested, people who earn beyond a certain threshold may see their benefit reduced or clawed back, which creates confusion and discourages some from applying. Worse, recipients of provincial disability programs, such as Ontario's ODSP, often fear losing existing benefits if they receive federal ones. The rules for how the CDB will interact with provincial supports remain unclear, leaving applicants worried about being penalized for seeking additional help. Processing delays add to the frustration. Approvals can take months, and the benefit amounts may not be enough to keep up with inflation and rising costs of living. For applicants living paycheck to paycheck, this delay can mean choosing between paying rent or buying groceries while they wait. Combined with the high cost of medical care, assistive devices, and transportation, the financial delays make the CDB feel more like a safety net with holes rather than a reliable lifeline. This uncertainty around money makes the program tough to access in practice, even after approval. Systemic barriers and stigma. Finally, systemic issues make the CDB tough to obtain. The disability support system in Canada has historically been underfunded and fragmented, with federal and provincial programs often working in silos. This leads to duplication of paperwork, inconsistent rules, and confusion over which benefits can be stacked together. Many people also face stigma when applying for disability benefits. They may feel judged, doubted, or forced to prove their disability repeatedly to different agencies. This is particularly true for invisible disabilities like chronic pain, mental illness, or neurological conditions. The process can be emotionally draining, leading some to give up altogether. Additionally, marginalized groups, such as racial minorities, newcomers, and Indigenous peoples, face higher barriers due to systemic inequities in healthcare and social services. Without targeted reforms to simplify applications, reduce stigma, and integrate provincial federal systems, the CDB risks replicating the very issues it was designed to solve. The end result is that the people who most urgently need the benefit may be the least likely to receive it, leaving Canada's disability community still struggling for basic financial security.